Thank you for meeting with me today, everyone from the Bill and Melinda Gates Foundation. My name is Laura Delakai. I am the program manager, and today I will be discussing mothers and babies in the aftermath of the drug crisis. So I would like to start off by saying what the current problem is that is going on right now and why I'm here today. We have a current issue of pregnant women who are using meth, specifically are lacking necessary prenatal care and addiction treatment for meth-related um, use, specifically due to the lack of research around methamphetamine and the services for pregnant women who suffer from polysubstance use, which includes meth use. Additionally, some data to support this problem is that methamphetamine use while pregnant is currently on the rise. We know a lot about opioids, but we do not know a lot about meth use and its effects on pregnancy. Another big issue is that there are no medications to specifically treat meth use while there are for such issues like opioids. So that's a giant factor contributing to the problem, and providers know this and they're not sure how to deal with this population group that they see and how to help them seek treatment if there is nothing to treat it with as pharmaceutical wise goes. And there is also little known about the long-term outcomes of how meth use is going to affect fetuses in infants. There is research to show there are negative health outcomes, but the lack of research is really concerning as we're not fully aware of what's going to be happening to these people long term. So just to better define the population that is affected is specifically pregnant polysubstance use users. Some health inequities contributing to that population, which is being more affected than others, is the lack of access to treatment options, again, because meth is not treatable by medication and there needs to be other ways in order to treat methamphetamine use. Some health indicators that are showing that these women are being affected more than others is based on their neonatal health with adverse childhood outcomes, continued substance use, specifically of meth, and the high prevalence of use of meth in the southern part and Midwest and western part of the United States, especially in rural areas. And factors that will be contributing to the rise in meth use will be lack of education, poverty, unemployment, which kind of goes in hand with poverty, lack of access to mental health care, which is huge, especially since meth cannot be treated with pharmaceuticals, isolation, especially in rural areas, and the lack of screening and unhealthy drug use. So just to go over the social ecological model, which is how this problem is affecting each level related to the health issue. So on the personal level, which would have to deal with the person who is using meth and other substances, would be the fear of addiction withdrawal. This might keep them from entering any sort of program that might help them detox from meth use. However, a supporting factor would be their mother's concern for the health of the fetus, and that might drive them to seek treatment. Again, social emotional support is also going to be a positive contributing factor. If they feel that they have the support group necessary to help them through this difficult process, they're more likely to seek treatment, whereas social exclusion is going to just make them revert back to their current coping mechanism, which is using various substances. Another issue hindering treatment for this population is the lack of insurance coverage. However, there are programs right now between local health departments, state health departments, and local hospitals having new mothers visiting nursing programs where they meet with the mothers for a first time visit after they have their first child or after every new child is born, which can help to bridge the gap of resources that these individuals might need. And then at the community level, we have the issue of stigma preventing people from seeking treatment and the judgment they might face for being found out that they are polysubstance users. However, peer support groups and talking about these serious health issues at local schools, churches, and community health clinics will help to deter that issue of stigma. And then on the policy level, we're trying to see statewide and national change by, in some ways, invoking penalties against parents who decide to use polysubstances while pregnant or after their child is born. However, there is a more proactive approach, as well as some states are adopting funding specifically to target drug treatment programs with priority access to certain individuals, like polysubstance users who are pregnant. We also have three interventions we're going to explore in order to deal with this problem. They are all similar in nature, so we're not going to go in depth on each slide. You can visit those at your leisure, as intervention components and resources and considerations are all necessary. So a lot of these intervention components will be consisting of various types of counseling, whether individual or in group, different types of treatment to prevent relapse and resistance to relapse, parenting education on how to cope with their child while coping with their own personal problems, supervised visits for mothers without custody of their children, weekly support groups, case management, and medication assisted treatment when applicable if they're using other substances like opioids that can be treated with medication. And resources that are going to be needed to implement these types of interventions is going to include staffing, which is clinical and non-clinical staff. You're also going to need transportation, as a lot of these people may be under-resourced and may not have their own transportation, or cannot get to the proper facilities without some sort of transportation. Even public buses may not go that way. There will also be pamphlets needed for educational materials, as well as office supplies to conduct basic follow-ups and creating appointments. You'll also need incentives such as food and gift cards in order to initiate contact with the clients and ensure that they're going to be interested in joining the intervention, as well as a rehab facility or beds, especially if you're doing inpatient detox, as well as some sort of sustainable funding. And some considerations that we need to think about are patient lacking insurance or are underinsured. How are we going to bridge the gap so that they can still get the treatment they need, but that we can still support this type of work and pay the staff that we need to in order to get these women the treatment they need. We also need to address any cultural concerns of those who may not believe in therapy or showing signs of vulnerability or pain, like we see with our Asian population and our Hispanic Latino women. They are the emotional support provider versus the financial provider of their family. So we also need to consider how they're going to balance their own emotional well-being with that of their family members. And here you can see we have similar resources and intervention components, as well as childcare. This may not be their first child, and they may need to spend more time away from the current children so they can focus on treatment while they are carrying their other child. And so one proposed evaluation of the first type of intervention would be mental health referrals. So we want to see how many people are coming for counseling and therapy. Intermediate would be how many patients are completing the program and detoxing before they're giving birth. And then the long-term follow-up would be if whether or not the mother stayed sober after 1 year of ending the program. In the second type of intervention, we would be looking at dropout time as the short term, how many people were early dropouts or late dropouts versus those who did complete the program. And those who completed the program, we would be moving to the intermediate level, hoping that we could see them acquire stable housing. And then obviously long term would be whether or not depression and meth use improved or was abstained, and we could find these results through community surveys, follow-ups through focus groups, also infant health records, and doing key informant interviews. And for the last intervention, we would be conducting mothers and babies provider training, short-term outcome measurements would be attendance and completion that the physicians finish this program. Intermediate would be how many referrals the providers are giving after the training is enacted, and then how many of those referrals are actually reaching out for support and treatment. And then some potential challenges and barriers we need to consider is loss to follow-up, especially when trying to collect that quantitative and qualitative data. Fear of criminal penalties if they disclose that they might be using illicit drugs. Stigma is a huge one. Also, culturally sensitive tailoring. If you're not understanding the type of individual or group of people you're working with, their program may or may not work for them based on their cultural values. And then obviously a huge thing is sustainable funding, which is why I've approached the foundation. Some of the partners that we will be able to work with would obviously be the Bill and Melinda Gates Foundation. We hope that they would support our project financially. We would also like to work with local health departments and state health departments to implement maybe community outreach to individuals who may be suffering. We'd also want to get referrals from Department of Children and Families who parents might need help in order to regain custody of their child. We'll also want to work with some type of addiction treatment provider and or rehab facility that will partner with us in order to conduct this intervention. We also want to work with providers and clinicians as well, since we need clinical and non-clinical staff. And then we would also like to partner with law enforcement, especially probation officers, rather than enacting criminal penalties such as prison time. They might be mandated to go to a detox treatment program. And then here's just the logic model, which is outlining the different types of inputs that we talked about earlier, the activities that we're going to be conducting, the outputs, the short-term impacts, and the intermediate impacts. And then I would like to just conclude with a quote from the American writer George William Curtis. Happiness lies first of all in health. And I would just like that to be the takeaway of today's message, and that if we invest more time in these mothers and their unborn children, we're going to have to deal with a lot less aftermath of the drug crisis if we just continue to be a little more proactive. Thank you so much. And here are my references for my research. Thank you.